With the next speaker, Dr. Ahmed Gouda, pediatric consultant and diabetic lead at George Eliot Hospital in Birmingham. Dr. Ahmed achieved his consultancy post through the CESR pathway, and Dr. Ahmed has been involved as well in supporting IMG and SAS doctors, and will be speaking about CESR as an alternative route to consultancy. And we are very pleased to have his perspective and experience today. I'm just going to start recording the meeting again, and then it will be over to Dr. Ahmed.
Thank you very much. So my name is Ahmed. I'm a pediatric consultant at George Eliot Hospital and the pediatric diabetes lead. I'm also ePulse instructor. I have completed my registration through CESR pathway. So today I'm going to talk about the CESR. I will make a quick introduction about CESR, and I will go through my application and go through every domain to share my practical experience and give you my experience through it. So let's start. I'm gonna share my screen with you. So quickly, we'll talk about CESR. So it's certificate of eligibility of specialty registration. It's route for doctors to be on the specialty register without UK CCT, and we have to bring the evidence that the trainee have to bring throughout their training. So it's 11 domains. So domain one, you have to give evidence about your professional values and behavior, just like appraisals, reflections, multi-source feedback, complaints, and health declaration. Domain two, you have to bring evidence about MDT working, patient communication like CPDs, showing how you communicated with patients, handover feedback like HAT, consent feedback, complaints handling. Domain three will be procedures and skills. You have to give some evidence about the procedures you have done, either DOPS or logbooks. You have to bring both because not all the procedures were supervised by a senior colleague. And the evidence of independent practice, like if you got you're doing a clinic on your own, so clinic list showing your name on the clinics, that will show evidence of independent practice. Domain four, patient management. So you have to present some case histories, some outcomes of the audits you have done, some CBDs which involved the patient, and management and discussion with the parents, clear plans with that. I will go through my application, and it will give you a clear picture about that. Domain five, health promotion. If you've done preventive medicine, if you got any courses, have you done any education to the parent, like if you've seen an asthma and you explain to the parents how to manage asthma and these kind of things. Also with diabetes, newly diagnosed diabetes. Domain six, leadership and team working. So it involves something like ECAT, ACAT, leadership CBDs, and management courses. Domain seven, it's about patient safety. So if you involved in DATIX, you have done DATIX, duty of condor, risk management courses, etc. I'm mindful of the time, so I'm just going and I want to elaborate more in my application. Domain seven, patient safety. As I mentioned, any incident you were involved in, duty of condor, risk management courses. Domain eight, quality improvement. You have to show evidence of audits you have done, and you have to be the lead of the audit and the QI projects. It's very important to have QI project because my application was postponed for 6 months because of the QI project. And you have to prove evidence of how you participated in service improvement. Domain 9, safeguarding, any involvement in safeguarding, any strategy meeting, any courses you have done, any reflections on the cases you were involved in. Domain 10, education and the training. So you have to prove evidence of any teaching rules you have done, like if you were uh, responsible for the teaching route at any time of your career, any teaching presentation you have done, any feedback from your colleagues about teaching, any courses like teach the teacher, train the trainer, any courses you have done. And the last domain is the research, any publication you have done, any presentation, and critical appraisal skills, any any consent, good clinical practice course, etc. So quickly, I will go through my application to just go through the domains. Do you still see my screen or?
Yes, Dr. Ahmed, yes.
Okay, so let's go to the first domain. Domain one, professional behavior. So in domain one, you have, as you said, as you see, I have shared my appraisals. And B, actually, I have done three appraisals at that time when I submitted my CESR application. And it's important because we are limited by the number of uploads. We have about 150 uploads, which should be around 1,000 paper. So when you submit your appraisal, you have to submit the summary of the appraisal, not the full appraisal, because it's very big, and so the summary would be fine. So every appraisal you have done before the date of submission of your application should be uploaded. This is the first thing in this domain. So 1 second. Yeah. And also you have to prove evidence of your independent practice. So here I have provided the list of all my clinic, not all my clinic list, but give a sample of your clinic list and make sure you have just redacted all the information about the patient, date of birth, NHS number, and all these things. I have uploaded about six of this. You can get it from the secretaries, and just make sure that you anonymized all the things. I have uploaded two from two hospitals I have worked in. So appraisals, clinic list. Also, if you've been involved in court report, so it's very important. It's very supporting thing, but it's not mandatory. So I was involved in court report, so I have uploaded the court report of it and made sure that everything is anonymized for uh, this, because the RCBCH will come back to you if anything is missing regarding anonymization. It's not a big issue, but you have to reflect on this, take a course. So make sure that you redact all the things. If you've been involved in any adoption report, can support. It's not mandatory. I have done some community pediatrics during my training, and I have done one adoption report, which I have submitted as well. Um, and then if you got any courses involved in this domain, I have submitted some courses. It's very simple courses: spotting sick child and meningitis research. It's anything, any courses you have taken relevant to this domain, because every domain needs, if you got courses relevant to that domain. And very important thing to provide job plan and job description. You can find them on the job plan. I think you will get it from the trust. Job description, you will find it from, sorry, if you remember the advertisement of the job the job description was there. If you don't find it, you can reflect on it, do a reflection and submit it. So I have submitted the job plan of all the jobs you have done so far until the time of the appraisal, the submission of Caesar. So now appraisals, job plan, evidence of some courses, clinic list, and the patient log. So the patient log like this. So you will make an Excel sheet and give a sample about the patient, not all the patient you have seen, but sample of the patient. So just don't write any names, anything, just write the date and the problem, like initial health assessment and the plan, brief description about that. It doesn't need to be signed. It's something you have done, and you put summary like 21st of February, 21st of March, 2 cases, 3 cases every month, and samples of the peer review meetings, because not all the meetings you have evidence uh, from them. So just it's an Excel sheet. You have to demonstrate what you have done. It doesn't need to be signed because all the evidence needs to be signed to put in a performa and signed by a consultant in the hospital. Any reflective notes you have done. So if you've, let me just open it. Any reflective notes about the behavior. So in my reflective notes, I have submitted one about uh, father who became aggressive, how you deal with him, something to evidence that you manages difficult situation in a professional way. And the router, you can get a sample of the router and you rule in the sample. Try to just get a brief, the large router, to give an idea about the shifts you've covered, your rule at this time. So I have provided a sample and I try to anonymize as much as I can from my colleague's name. Colleague's name is not something serious if you can't anonymize them, but the patient details is very important thing. Also, safeguarding reports. There is a domain about safeguarding, but if you got any safeguarding reports, samples of the safeguarding reports, so not all the reports you have been involved in. So I have submitted only 4. Remember, they are considered. The most important thing is the quality, not the quantity. So it's not about submission of hundreds of CBDs, hundred of the courses, but it's about the quality of the CBD you've been involved in. So in summary, clinic list is something very important. Appraisal is something very important. Evidence, the courses about this domain is very important. Job plan and job description is very important. And patient log, you can do Ruta, you can access reflective notes and reports. About the court report and the adoption report, it's not mandatory, but it's very important. If you have any evidence can support your application, it's very important to upload. I'll go quickly through the domains because I'm mindful of the time. But at the end, if you got any questions, you can ask. Regarding domain 2, it's about communication. So in domain 2, the communication between parents, the communication between the patient. So the CBDs, I've just submitted 2 CBDs about the communication, and it was about the communication with the parents. So when you see patient in the clinic, and my cases was about how I spoken to the parents about the management. So for example, if you got asthma patient who's newly diagnosed and you started to teach them about how the parents, how to use the inhalers, how to seek advice, and you give them some leaflets. So it's something I have submitted. Also, the other case was about a newly diagnosed diabetes presented with DKA, how I spoken with the parents and give them idea and told them about the management. Discussion of correspondence. I have submitted some. One, two, three. I have submitted only three, which is was enough. And I have submitted three, and the two from the other hospital. Hat, if you, it's, I've submitted about one, two, three, four. Handover assessment tool. It proves a clear communication with the parents, and I got feedback on them, and I uploaded them from my portfolio to prove a clear communication between my colleague. And the multi-source feedback, the 360, so you have to upload the multi-source feedback to prove that you've got a very good feedback or good feedback from your colleagues and the parents as well. And it's important if you got reflective notes on every domain. So, and this is something not needed to be proved or signed by consultant or senior colleague. If you attended a word round MD team, so you do a reflection on this, which shows a clear communication between the team. Um, so CBDs, any communication courses, like for example, I have submitted the courses medical team communication skills from Oxford. It's online course, which sorry, and advanced patient communication skills. It was a bundle I completed from Oxford University. It's online, so it's you can easily do them. It's a bundle of four courses. Two of them was relevant to this domain, which is advancing patient communication skills and the medical team communication. The bundle was four. The others I put in the other domain because it was about the leadership. So CBDs, courses, discussion of correspondence, handover assessment, the multi-source feedback, and MDT meeting attendance. So MDT meeting attendance, what they need is the minute. The minutes of the meeting, like for example, I got this meeting, I attended this meeting, and I asked for the minutes after the meeting was done, and I anonymized the names of the other attendees. I kept my name, and that was an evidence, enough evidence for this. This is about domain 2. And domain 3 is the procedure. So any courses you have attended relevant to this procedure, like NLS, ePulse course, any GIC course or anything reported to this. And so the docs I have got, so I have uploaded them, downloaded them from my portfolio, and it's about the mandatory docs. So all the docs I've done, even I have done echo, I got a good, I got feedback on it. So I have uploaded all of them. So UVC, UEC, cannula, lumbar puncture, all the mandatory airway management. So I have uploaded all the procedures from my portfolio, and also I have made a procedure log, because as I said, from each hospital, so from George Eliot Hospital, from Royal Sussex County Hospital, and Basildon Hospital, all the three hospitals I have worked in, I have done a Excel sheet, which I have done like randomly, like 10 of January, 24, 16th. So all the things, airway maintenance, lumbar puncture, chest drain, everything I have done, I got a sample from it. Like for example, if I have done like 10 LPs, I just submitted one or two, which was enough. And from every hospital, I have done a procedure log about that. And reflective notes if you've done like failed lumbar puncture, which was one of my reflective notes. UVC position, which was wrong positions, what I have done, what reflection on it. So this domain is mainly about the procedures. So the courses like NLS, ePulse, the DOPS from your portfolio, procedure log. You have to do a procedure log for every hospital you worked in, and reflective notes on the procedure reflective notes. Domain 4, it's about patient management. So again, you have to provide evidence of the CPDs about the patient management. So if you were involved in any of the neonatal management or any clinics, how you manage, you have to prove how you manage the patient. And this, like for example, here from Royal Sussex, 33 weeks gestation, induction, day 11 of life, what happened with him, and make sure you provide, as I told you, the main thing is the quality, not the quantity. So I have submitted only 5, but 5 in details, and there were interesting cases. Also, handover sheets, you have to get sample of the handover sheet from every hospital you work, to just give them an idea about the kind of patients you were involved in, to give an idea about how did you manage them. So extremely preterm baby, IUGR, prematurity, distended abdomen, and mild HIE. So just to give them some sample about um, from the handover sheet, and also make sure you anonymize all the patient information. So CBDs about patient management, handover sheet, provide some sample of handover sheet, not all, the many cakes you were involved in, patient logs. It's so logbook about the patient, kind of patient you were involved in. Again, it's an Excel sheet. You write the date, and you write a brief summary about the problem. So 8 year 9 months problem, cough, abdominal pain, what you've done, start IV fluid, continue Novorapid, and Lantus. He was diabetic. So just to give them a brief description about the management. So this is you can do about it doesn't need to be signed by consultant, because all the evidence will be put in a pro forma and will be signed by a consultant in every hospital, and some reflective notes. So this is initial health assessment for asylum seeker. Again, it's not mandatory. I was involved in community pediatrics for 3 months, so I got some evidence. But the CBDs, handover sheet, many cakes, patient logs, and reflective notes are important in this domain. Domain 5, health promotion. So you have to prove some evidence about health promotion. So like CBDs, let's go through this one. So again, it's exacerbation of asthma and how you improve health promotion. So I have spoken to the parents. I spent a lot of time, and I mentioned this very clearly in the notes, that the main thing I focused in is the patient communication to encourage health of the child, make them aware how to deal with asthma at home if they got asthma exacerbation or DKA, and make sure to if any CBD can be linked to 2 domains, like asthma can be linked to health promotion and patient management. So one CBD can be used in 2 domains. And the courses about health promotion. So, like for example, I have attended a course by RCPCH about vaccines in practice. So this is in health promotion, infection prevention course. So I have submitted these 2 courses. So all the courses relevant to these domains, and also reflective notes. So only these things covered this domain. So the CBDs, the reflective notes, and the courses you have attended. Domain 6 is the leadership. So the leadership, I have submitted ACAT, ECAT, clinical governance, I have attended, and the courses, leadership courses, again, I have submitted medical leadership from Oxford and management. It was online course from Oxford. So every domain, the courses and CBDs, ECAT and ACAT, I have submitted one of them about how I manage the crash call about ex-preterm baby, and the other, the ECAT, I have submitted. I led the ward round as a registrar, and then I discussed with the consultants the plan, etc. The MDT leader, I have attended. I was doing cerebral palsy. It's MDT clinic, so I just I anonymized the patient information and then I put the problems. It's MDT clinic. I put the clinic letter of this. Any MDT meeting, you can upload the meeting of it. If you've done any cerebral palsy, it's a joint meeting. Diabetes clinic, it's MDT. You have psychologist, you have a dietitian, you have the nurse. Again, I was involved in EHCP's Educational Healthcare Plan, which I have submitted, and the leadership MDT meeting. And I was a teaching rota coordinator at one of the hospitals, so I got approval of it. And here I was a clinical governance lead for 1 year, so I got a certificate that I was a clinical governance lead. Again, not all these things needs to be submitted. Just submit as much evidence as you can um, in every domain. But ACAT, ECAT, CBDs, and the courses and all MDT meeting you have attended are very important. Domain 7, the patient safety, so you have to give some the courses again. So pediatric prescribing principle 2016, it's very simple course, but this is the course I have found at this time to just support this domain. CBD about patient safety, I have submitted CBDs about like CAMS patient. If you've seen a CAMS patient and you have admitted as a place of safety, it's but just in every domain, just try to focus and make it sure in the CBD that you mention the reason why you put this domain in patient safety. So it's CAMS patients needs to be admitted as a place of safety. Duty of condor, it's all the datics you were named in or the datics you have done. Just gotten evidence from your hospital about the datics and make sure you anonymized everything. So this is one of the datixes I was involved in. I just submitted it. Again, looked after child is part of the community job, so it's not mandatory, but it helps. And reflective notes about this domain. So I have seen suicidal ideation and self-harm, and I have described what I have done. Again, I have contacted the CAMS team. I have admitted him. I have discussed with the parents. Even if it's difficult communication, you have to reflect on it. And this is about, I worked in the transport team, so I've got some transport letters and about the transportation of ex-preterm babies, how you discuss with the accepting unit, referring unit, and your consultant at the time. Domain 8, it's about the quality improvement project. In this domain, you have to submit the audit and the QI projects, and this is something important because something happened to me and led to just my application was postponed for 6 months. In this QI project, you have to submit the certificate that you led. So the certificate is very important. Certify has been involved. This is something I was involved in, but it needs to be leading at least one audit and re-audit. You submit the certificate, you submit the presentation of the audit and re-audit, and it's very important to lead. I have submitted all the audits I have been involved and led, and the QI and the re-audits, and all the courses relevant to quality improvement. So this is a course about quality improvement, how to make works better. It's only one course I have submitted. Then all the domains, I will tell you this at the end what happened in this domain, because that was the only domain that I had comment on and needed to just submit another evidence after 6 months. Safeguarding, again, I'm mindful of the time, so I just going quickly. So strategy meetings you have done, if I uploaded it from my portfolio and submitted it, so strategy meeting you were involved in. So if you have done any safeguarding case, ask your consultant to just involve you in one at least strategy meeting. And we have overview panel, child this overview panel, which happens in our department. So I attended one and submitted it. Um, and the child protection, some example of the child protection peer review. So attend at least one and submit it. And the courses relevant to safeguarding. So safeguarding level 2, safeguarding level 3, that's what I have submitted. And safeguarding CBD from your portfolio. It's and if you got any CBDs, just try to have one. And the reflective notes can be something if you don't have CBDs. Domain 10, it's about education and training. So all the courses you have got, I have submitted 10 courses. So teach the teacher, train the trainer, attend some of these. It's very good courses and support your application. Um, Morbidity and the mortality meetings, and any simulation you have done. So any teaching route, no, you have to bring evidence that you were involved in the teaching route. So just I got, like, for example, a teaching route, my name was here, so I just brought an evidence that I have done teaching. I brought one from every hospital I worked in. Any conference you have attended. I have done an oral presentation in the RCPCH conference. So I have got the certificate and just uploaded it. And the last domain is the research. So in the research, I was the most important thing in this part is a good clinical practice certificate. It's online course. It's 2-hour course, so it's very important. If you have done any consent, just do a reflection about it. So consent is very important. And I was involved in Aztec trial. I was just my rule was about just speaking to the parents, take the consent from them. So I got a certificate that I participated in Aztec trial. I was involved in some guidelines updates, so I brought an evidence about guideline update. I got a certificate from the hospital. I asked for, the hospital to send me a certificate about that. Any journal club you have done, and any publication, I have done a publication in RCPCH. And also the feedback from your colleagues are very important. So I just submitted all the feedback in one PDF file. And then we'll go to the last thing is the performa. So you've got all the evidence, you've got all the things needed for every domain from, like, for example, 2 or 3 hospitals. Every hospitals you have to have, this is very, you have to have a performa like this. The performa you can download from the GMC website, and then for every hospital, like, for example, your name, your GMC number, and the hospital. And then you have to upload like appraisal. So Georgia Elliott Hospital, it's 10 paper and it's PDF. You have to write the format, the day, the year, date of the document, the format. They accept PDF and Excel and Word, and total number of pages. So everything single thing needs to be like this appraisal. So the file name should be the same you uploaded in Georgia Elite Hospital. So the file name was Georgia Elite Hospital Appraisal 2223. The type is PDF and it's 10. the number of pages 10. ARCPs and the training assessment, so communication CPD, PDF, 3 papers, so logbook, procedure log, the name is procedure log, it's PDF, it's one paper, patient log, it's 5 pages, and yeah, then you have to just do everything, make sure that the number of the pages correct, the date, the year correct, and the format is correct. And then at the end, the verifier have to do this is before you have to just print it or send it to your verifier, and the verifier will sign it. Once he sign it, so that's all. Let's go back to. So, if any question until I just sort this out, if any question, because I'm mindful of the time, I'll stop the.
Yes, we have, I think, a couple of questions. The first one I'm going to read for you is from Ahmed Hatata. Is asking about. Thank you so much, Ahmed. You definitely put a lot of effort in your application, covering the 11 domains. Did you have to merge your documents, which cover every single domain, to reduce the numbers of your uploads?
Actually, you have to merge all the things. Like for example, if you just have 4 CPDs, don't upload every CPD in it. No, just use like any application to merge them in one file, and just submit it as one file, and label this file 4 CPDs. So should be in one file.
Perfect. So the second one is asking about, please, what is the Oxford course attendance?
Because it helps in the application. Like for example, if
Sorry, the question is what course?
What the course is? It was a bundle like advancing patient communication skills, patient advancing patient communication skills, leadership and management. It was a bundle. You can find it online, and it was recommended by one of my senior colleagues. And actually, I found it really useful.
Good. And there is another question also from Ahmed Hatal, asking, also sorry for a very basic question. What program did you use to?
It's paid one, but actually for redaction, he asking about the redaction.
Yes.
There's lots of applications. I used one. It was expensive, to be honest, but I don't recommend it to anyone. There is some free trials for a month. You can just use them. And the GMC came to me because the application will be reviewed by a GMC representative to make sure that you covered every domain before submitting to the Royal College. So they came to me and told me that we managed to remove the reduction from couple of your uploads. I was wondering why, because I used the same application for all the uploads, but they came to me back with 3 or 4. What I have done, I took screenshot from these and submitted them as a screenshot, and it was successful. So there are lots of applications you can use to redact, but don't worry. I think all of our colleagues who submitted CESR, the GMC advisor came back to them. We managed to remove the reduction, but it wasn't serious, and they didn't even ask for a course or reflection on it. Do your effort. There are lots of applications. Most of them are free. I paid for one, but I don't recommend, because it came to the same result as free application for 1 month, and it was okay for them. My advice to you is just start now. Open the application with GMC. Try to upload as much evidence as you have, and try to see what you're missing, what documentation you need to do. The application will be open for 1 year, but once you open the application, it will help you to just do and upload all the needed evidence. And once you feel that you covered all the evidence, my advice to you is to submit, because you will never know what you're missing until you submit your applications. They will come back to you, most likely successful, and they will send it to the GMC, or there are something missing, which that happened to me. I have uploaded everything. They came to the domain about quality improvement project. They said, you have done audit, you have done re-audit, you have done reflections, but you haven't done any QI project. I explained to him that I have done audit and I did action. I've done a re-audit, so this is QI project. He came to me, no, we need a clear certificate from your department stating that Ahmed has led a QI project, etc. So it took me about 6 months to just do, because the QI project takes time. If it's CBD or something like this.
Thank you very much, Dr. Ahmed. That
Thank
was
you very
really
much.
informative from your side, running through the actual application and showing us all the folders and how you actually organized yourself to be able to apply. So actually that was hands-on, which is very important and very different.
Thank you very much, and sorry for the technical issue. Thank you very much.
No, it's all right. Don't worry. Thank you very much for that.